To talk tonight about the opioid crisis.
The Senate is in a quorum call.
I ask unanimous consent that the quorum call be dispensed with.
Without objection.
I'd like to talk tonight about the opioid crisis that has gripped my state of Ohio and our country, and talk about some lessons learned. There was an article in the New York Times, some of you might have seen, on Sunday about a town in Ohio, Dayton, Ohio, and the progress that they've made in combating this opioid crisis, including a reduction in overdose deaths, which is really significant. Dayton is a city that's had some of the highest overdose death rates in our entire state of Ohio, and Ohio is probably number 3 or 4 in the country in terms of overdose deaths. They have seen in Dayton, Ohio, over the last year, about a 50% decrease in overdose deaths. Now, it's still totally unacceptable. Unfortunately, there's still hundreds of people who are dying every year, but from this high watermark, progress has been made. Why has that happened? Well, I'm going to talk a little about that tonight and talk about some of the things that are actually working back in our communities, and perhaps give us a little sense of optimism about what might be able to happen over the next couple of years as we try to turn the tide on this epidemic. For a little context, last year, we had the highest rate of overdoses, the highest rate of overdose deaths in the history of our country. 72,000 Americans, 72,000 lost their lives to overdoses from drugs. In my state of Ohio, that number is particularly high to the point that it's the #1 cause of death now in our state. I met with the director of the CDC, the Centers for Disease Control, today, talked about the opioid epidemic and talked about the tragedy he's seeing in places like Southwest Ohio, Dayton and Cincinnati, my hometown, where we see incidences of hepatitis C increasing and even hepatitis A. These are diseases that are primarily increasing because of the sharing of needles and the opioid epidemic. So we've got our work cut out for us, don't we? In Dayton, Ohio, by the way, over the last few years, the death rate had gotten so high that the coroner's office was literally running out of space. There wasn't enough room to put all the bodies. I've held roundtable discussions in Dayton and in Montgomery County, which is the county around Dayton, over the past several years, and heard the bad news. I've often been with Montgomery County then Sheriff Phil Plummer, who has been tireless in trying to focus law enforcement and the social workers and the treatment community and the business community and other community leaders on how to respond to this problem. Our first responders, of course, are as desperate as anybody to address it. It's been tough. You know, again, I've been in Dayton, Ohio, and had to talk about the fact that we had the worst rates in the country of deaths, and therefore one of the worst in the entire country. So what's happened? How has Dayton made this progress to have this 50% reduction? Well, the New York Times highlights a number of reasons for it. They talk about greater community involvement, the ability for more Medicaid recipients to get treatment, more Narcan being distributed throughout the community. Narcan, of course, is this miracle drug that reverses the effects of an overdose. They've talked about helping to deal with the stigma. In other words, by reducing the stigma that's associated with addiction, more people will step forward to get treatment for it, and their families will be more willing to push them forward. That helps to unite communities against what is the biggest public health crisis we face in Ohio and around the country. And I'd like to highlight tonight some of the things we've done here in this body just in the last couple of years that contributes to some of the success that we're seeing. Again, are we there yet? No, we're not. Last year was worse than the year before. But I do believe that we're going to begin to make progress. And frankly, I think we would already have seen some of these efforts at the federal level, state level, and local level, which are taking root, make a bigger difference, but for one thing, and that is this big influx of synthetic opioids, fentanyl. Fentanyl, carfentanil, and other synthetics have taken over. I remember being in Dayton, Ohio, the city we're talking about tonight, about 4 years ago, when for the first time I heard from a law enforcement official, fentanyl is pushing out heroin. At that time, the big issue was heroin. It wasn't fentanyl. In fact, very few people knew about fentanyl. Fentanyl has hit my state and our country so hard over the past several years, the last 3, 4, 5 years, that it has sort of overwhelmed the system. So as we've begun to make progress on better education and better treatment and better recovery options and more Narcan, we've also had this big influx of this incredibly powerful drug, 50 times more powerful than heroin on average, and inexpensive drug. We'll talk a minute about what we're doing about fentanyl. But again, I think if we had not seen that influx, we'd be seeing more progress because of some of the things that we'll talk about that are happening in Dayton, Ohio. Back in 2016, this body, after 4 years of work, passed legislation called the Comprehensive Addiction and Recovery Act. I was proud to co-author that with a colleague, Sheldon Whitehouse. It was bipartisan. It was nonpartisan. It was based on evidence. It was based on 4 conferences we had here in D.C. We brought in people from all over the country to talk about what is the best treatment option, what's the best way to ensure somebody gets through treatment successfully. How can we do a better job with our veterans? How can we ensure that we're bringing our first responders into this and working with them and helping them to be able to deal with this crisis? And all of that led to this Comprehensive Addiction Recovery Act legislation. The first thing that the legislation did actually was it said, let's look at this like a disease. And that may be, of all the things that are in that legislation, including significant new funding for our communities, maybe the most important thing is beginning to change the paradigm. Like we don't look at this as a moral failing, but rather look at it as something that is a disease. Something changes in your brain when you become addicted. And I can't tell you the number of people I've met in my home state of Ohio who, because of an accident or an injury, took an opioid, became addicted, physically addicted, shifted to heroin or fentanyl because the prescription drugs were hard to find or too expensive, and then overdosed, and in some cases, overdosed and died. But having said that, this legislation, this Comprehensive Addiction Recovery Act legislation, focusing on prevention, focusing on treatment, focusing on recovery, focusing on providing Narcan to our communities, has made a difference. There'll be $608 million spent this year on these care programs. Our first year, it was about $182 million. It's gone up every year since. Why? Because it's working. It was based on good evidence, and it's helping to offer innovative solutions to this stubborn addiction challenge we face in our country. Dayton, Ohio, Montgomery County has received $3.5 million in CARA funding. So part of the reason they've had some success is they've taken this funding and used it in innovative ways. It includes $2 million for first responders, about $500,000 for the city of Dayton to develop partnerships between first responders, treatment providers, responding to overdoses as a team. Somebody overdoses, Narcan is applied, their lives are saved. Unfortunately, still in America, in most cases, the person goes back to the community, to the old team, the old gang. And often there is no follow-up. In Dayton, what they've said is, you know what, somebody overdoses, Narcan is applied, we're going to follow up with them. And the team will include law enforcement, but it also will include treatment providers, maybe social workers. This funding has allowed them to pursue that. Also, $1 million from Montgomery County Public Health to analyze substance abuse issues and identify potential solutions to come up with more innovative and creative ways to deal with this. Also, in 2016, this Congress passed another piece of legislation. The Comprehensive Addiction Recovery Act, remember, is funding that goes straight to programs to help on, again, prevention, education, innovative solutions. The second one was called the 21st Century Cures Act. And this provides funding directly back to the states, and the states then decide how it is spent. That funding is also making a big difference. In each of the last 2 years, Ohio has received $26 million in cures funding to affect the opioid crisis. All of your states have received funding too. The funding's based on the degree to which you have a problem. So states like my state of Ohio, West Virginia, Kentucky, have gotten significant amounts of money from this because we need it. Again, Montgomery County Alcohol, Drug, and Mental Health Board, the ADAMHS Board, has received about $2 million in cures funding over the last 2 years in Dayton, Ohio. I've seen and heard about how that funding is being put to good use. Just a couple months ago, I was in Dayton. I took part in a roundtable discussion with the Montgomery County ADAMHS Board and discussed how they're using their cures money and their CARA money. They're using their cures money to fund a community-based treatment team. They're partnering with Dayton and Montgomery County Public Health Addiction Services to provide 24/7 ambulance withdrawal support, a community treatment team to help people gripped by addiction get treatment in their own homes, primary care for high-risk addicts, including pregnant women, and more. They're finding that's working. It's working not just, again, to have people be saved from an overdose by Narcan, but getting these people directed into treatment to actually help them with their addiction problem longer term. They're implementing impressive programs to help with some of the most vulnerable groups that are affected by this crisis, and that is mothers who are addicted and their babies who are too often being born with what's called neonatal abstinence syndrome. Because the mom is addicted, the baby is born with this syndrome, which requires the babies, a tiny innocent baby, to go through withdrawal. It's a very sad situation. It's happening in hospitals all over our country. Go to your neonatal unit in your hospital and you'll find out that unfortunately the numbers of these babies has increased dramatically. We don't know the impact longer term on these babies who are born to moms who are addicted. But there's a great risk there. What we do know is that hospitals across the country are being filled up with these innocent babies, and they need our help. After these babies get out of the hospital, by the way, often they can't go back to their moms or their dads because they're addicted, nor should they. The moms and dads sometimes are in treatment. They can't take their babies with them. What happens to these kids? Well, there's some groups that have started. Community volunteers have stepped up in Dayton, Ohio, as an example, and started a group called Bridget's Path. Bridget's Path is a shining example of an organization that's dedicated to helping newborns who are dependent on drugs be able to recover longer term. As these innocent babies are taken through the withdrawal, they also need to be surrounded by love and support. Earlier this year, I had the opportunity to visit Bridget's Path. They provide short-term inpatient care in a home-like setting for these newborns who are suffering from prenatal drug exposure. A lot of volunteers are involved. Some of the volunteers do something really important and really simple. You know what it is? They hold the babies. Literally, the human contact, based on all the psychological studies and looking at how you create a healthy, well-adjusted baby, you've got to have that human contact. And these babies who can't be with their parents because their parents are addicted, or maybe the dad isn't around and their mom is addicted, volunteers come in and literally hold the babies and love these babies and support these babies. We need to provide as much care and treatment as possible to help these kids so that they can achieve their God-given potential in life. And by the way, the opioid legislation that the President signed into law just last month that this Congress passed provides for the first time that organizations like Bridget's Path in Dayton, Ohio, entirely funded up to this point with volunteers, with money from the community, but frankly, they don't have the resources they need to take care of all the babies who need the help. These babies whose family qualify for Medicaid will now be able to get Medicaid reimbursement under what's called the CRIB Act, which the President just signed into law. It provides $60 million in funding for babies and recognizes residential pediatric recovery facilities like Bridget's Path as providers under Medicaid. This is a huge difference. It's going to enable not just Bridget's Path, but other organizations like this to pop up around our state. So that may not be affecting the overdose rate per se, but that's affecting something really important, which is the ability for these infants, these babies, to be able to have a normal life, to be able to achieve whatever God has in mind for them in their life, which is not to be growing up in a family with addiction, but rather to be able to escape the grips of addiction. I believe perhaps most importantly, legislation we just passed in Congress recently, adding to Cures and CARA and the CRIB Act, dealing with fentanyl, will help in Dayton, Ohio, and around our country. I mentioned fentanyl earlier, a synthetic opioid, 50 times more powerful than heroin, inexpensive. Sadly, while, again, Dayton's made progress, fentanyl remains the #1 killer in Dayton. They told me when I was there a couple months ago that cocaine and meth deaths, crystal meth, are rising in the Dayton area. Deaths from cocaine and crystal meth. Why is that? Typically, you don't hear about people overdosing on cocaine, but you certainly do when fentanyl is mixed in with cocaine. And that's what law enforcement is telling me around Ohio is happening. These drugs, often mixed with fentanyl, are now deadlier than ever. Fentanyl was involved in more than 70% of Ohio's overdose deaths last year. From January until April of this year, despite the overall reduction in overdose deaths, about 77% of the overdose deaths in Montgomery County in Dayton, Ohio, involved fentanyl. So again, we're making progress, but not nearly as much as we all want to make, and a major reason for this is this influx of this deadly synthetic substance. Unbelievably, we know that fentanyl is mostly manufactured in China and mostly comes to our country through our own United States mail system. And up to now, up until last month when the President signed this legislation, we did not have a way to screen these packages coming in from overseas, specifically from China, coming in through the mail system into our communities, causing all this death and destruction. Now we have in place something that closes a loophole in the international mail screening that requires the post office to do what the other carriers have had to do since 9/11, which is to provide law enforcement with advanced electronic data to be able to identify these suspect packages, get them offline, rather than coming into our communities. I think that's going to make a huge difference, not just because it's going to stop drugs from coming into our country, but because by reducing the supply, you're going to see the cost go up on the street, which has been one of our great challenges. It's not the ultimate answer. The ultimate answer is prevention and education, reducing the demand for these drugs, better treatment and longer-term recovery options, all the things we talked about in terms of taking care of these moms and babies. But we've also got to do everything we can to reduce the supply of these drugs. And that legislation that the President just signed is going to help. We're also going to be helped by a new law that the President just signed last month that says, with regard to residential treatment programs, they're no longer going to be capped by an arbitrary limit of 16 beds. This is a vestige of the 1960s and 70s when we wanted to deinstitutionalize people, particularly with regard to mental health, and we said that you can't get reimbursement from Medicaid if you have more than 16 beds for mental health and substance abuse treatment. Well, then the opioid crisis hits us, and suddenly we find ourselves with no room at the inn. I mean, literally people being turned away at treatment centers, and in the period that they're waiting to get in, overdosing and dying. And I've heard these stories. And I've heard these moms and dads talk about the pain of a child who finally says, I'm ready. One case, her dad takes her to the treatment center. This was in a teletown hall meeting I had. We'd have them every month, and I hear these stories. And these are people who aren't calling to tell this story, but they end up telling it because we're talking about this issue. In this case, this dad's heart was heavy because he said, we took her. She was ready. There was no room. They couldn't accept her in the treatment center. So we took her back home. In the 4 weeks that she was waiting to get a slot in the treatment center, what happened? She succumbed, once again, to shooting up, in her case, heroin, and an overdose in her own bedroom. So this arbitrary limit doesn't make any sense. I mean, if a treatment center is doing a good job, don't limit it to 16 beds. If it's not doing a good job, by the way, it shouldn't be getting any reimbursement. But if it's doing a good job and successfully helping people to get beyond their addiction and into recovery, we shouldn't be limiting it. And this legislation does that. It actually takes off the cap. It has a 5-year life because it has a cost to it. And I'm convinced that it's going to work and work well. And in 5 years from now, we will extend that even further. But this is something some of us have been working on for many years, many years. And it's now done. So, again, progress is being made incrementally. Some of this legislation we talked about tonight is contributing to that. We now need to ensure that we implement this. We cannot at this point take our eye off the ball. I think when we look back at this year, 2018, and we're coming to the end of the calendar year now, we will see for the first time, really in the last dozen years, a reduction in overdose deaths. I predict that's going to happen. And I say that in part because I spoke to the director of the Center for Disease Control today, the CDC director, but I also say that because back in Ohio, I'm seeing these programs work. I'm seeing, finally, us beginning to turn the tide, despite the influx of fentanyl. But I would just say tonight, if that's true, if we begin to see some progress, and again, I see it on the ground, I see it in the reports from coroners and medical directors around Ohio, if that happens, let's not take our eye off the ball. Let's not say, well, we've succeeded, now we can move on. We did that before. We did that actually back in the 90s with regard to cocaine. We'd solved the problem. we never solve the problem. It's like the tide. It keeps coming in. We've got to be vigilant. We've got to maintain the support that we have provided here in the United States Congress to push back against this terrible addiction, this disease. And we've got to ensure that we're not just pushing down on one drug and having another drug pop up. So as we make progress on fentanyl or make progress on heroin, let's also be mindful of the disastrous impact of cocaine and crystal meth and drugs we haven't even heard of yet, the new synthetic drugs that are coming our way. I believe that federal programs like CARE and Cures are making a difference, working with our states that are also passing their own legislation and helping in many ways, our local communities that are jumping in and figuring out innovative and creative ways, taking that federal dollar and leveraging it with private sector money, with state and local money. I believe we're going to make progress with the STOP Act in reducing the supply and therefore raising the cost of the drug on the street. I think what you've seen in Dayton, Ohio, that was reported in the New York Times can continue, not just in Dayton, but in Toledo, in Columbus, in Akron, in Cincinnati, St. Clairsville, all over our state, and then all over our country. But we have a role to play here, and that's to continue to be better partners, as we have been over the last 2.5 years here in Congress. Better partners with our states, with our local communities, with our families. Because ultimately, this is an issue of the heart, isn't it? This is about the future. We have some pages here with us tonight, some young people who are 16, 17 years old who come to this town because they're selected as bright young people. They are listening, at least they're acting like they're listening tonight, thank you. And it's about you. It's about you. It's about what kind of future you're going to have and what kind of future we're going to have for having safe and healthy communities. Thank you, Mr. President. I yield back my time.